Good morning, dear students. Today we'll study kidney function test. So now the question comes, why renal function test is done? There are many reasons. Some of them are given here. Firstly, to assess the functional capacity of kidney, early detection of possible renal impairment, severity and progression of the impairment, monitor response to treatment, and to monitor the safe and use of drugs which are excreted in the urine. Now, when should we assess renal function? Firstly, in the older age, or when there is a family history of chronic kidney disease, when the birth weight is low, in the cases of diabetes mellitus, hypertension, autoimmune disease, systemic infections, UTIs, or nephrolithiasis. So what are kidney function tests? Kidney function tests are simple procedures that use either the blood or urine to help identify issues in the kidneys. There are a few different types of kidney function tests that investigate various aspects of kidney function. A kidney function test may check to see if the kidneys are filtering waste products too slowly. Another type of test may see if the kidneys are leaking proteins into the urine. Function tests may either use the blood or urine to measure different aspects of kidney function. The kidneys, as you know, play a very important role in keeping the body healthy. Their main job is to filter waste materials from the blood and to send them out of the body in the urine. Kidney damage can prevent the kidneys from filtering the waste properly, leaving it to remain in the body and cause dangerous symptoms. So, regular testing should be done to identify such issues and keep the kidneys healthy. Urine test. Urine test may either require a small urine sample during a 24-hour period. Shows various aspects of urine, the color, clarity, odor, and the volume, and the normal values are given. What does the urine test show? Urine test helps to identify many undesirable particles in the urine, such as blood, pus, bacteria, sugar, or protein. If any of this comes positive, it may indicate an underlying issue such as kidney or bladder infections. A kidney disease, it can be a stone in the kidney or it can be a case of diabetes. Now the albumin area or the albumin to creatinine ratio. It also requires a small urine sample. They both help identify levels of albumin in the urine. Albumin, as you know, is a protein in the blood. If the kidneys filter too much albumin out in the urine, it may be a sign that they are not doing their job correctly. A urine albumin result of 30 milligrams per gram or less is normal. Anything higher than that is an indication of kidney disease. The microalbuminuria is a much more sensitive test which can detect even tiny amounts of protein in the urine. Kidney clearance test. This can be done both by the blood and the urine. It involves collecting all the urine a person creates in 24 hours as well as taking a small blood sample. In this, the amount of creatinine in the urine sample is compared to the level of creatinine in the blood. This comparison shows how much waste the kidneys are filtering out, which may be an indication of the overall health of the kidneys. In the case of blood test, the person may need to fast beforehand or do the first thing in the morning. Creatinine test. Serum creatinine levels that are too high may be a sign that the kidneys are having trouble doing their job. Serum creatinine levels above 1.2 for women or 1.4 for men may be an early sign that the kidneys are not functioning as they should. These numbers may rise further as kidney disease progresses. Now comes the GFR, or the glomerular filtration rate. Is calculated by taking the result of serum creatinine and adjusting them for a number of other factors such as age, gender, race. A GFR around 60 or below is a sign of kidney disease. This is the BUN, or the blood urea nitrogen test. In this, the waste products are checked in the blood. A typical BUN levels fall between 7 and 20 milligrams per deciliter. Higher values could be a sign of an underlying condition affecting the kidneys.